Hi, I'm Dr. Paul, and I wanted to show you a couple of neat things to do to treat for headaches. There's multiple causes of headaches, and my patients that go on a weight loss program sometimes will have headaches as a response. But if they've had a history of headaches, it could be pronounced, and the cause of the headaches may be in addition to the weight loss. So when you're going to weight loss, you go into a thing called ketosis, which is a fat burning mode, and your body can get dehydrated. So that's why you got to do salt. The salt that we include is a natural sea salt, so you have to do that, not regular salt, but just a salt that is on our program. And then and because your body's going to flush out all the minerals, and so what we need to do is replenish that. So water will do that, the salt will do that. Make sure that you do Epsom salt baths with either your feet, at least your feet with Epsom salt, or 2 cups of Epsom salt in a full bath, which is preferable. And you can do it anytime during the day, but especially at night right before bed will help sleep. If you're in pain, do it during the day as well. If you can't not do the full bath, then do a foot bath for at least 30 minutes with hot water. So now I'm going to show you some pressure points for the headaches. So if you take a look at your hand right here, what you're going to do is put your thumbs together like that, and you can see the tip of the heel right here, right there. And if you put your thumb directly into that tip right here and you press in while your thumb is together, don't let go of your thumb like that. You press in like that, it will be tender, and you massage that point until the headache goes away. And mine is tender right now. And then the same thing with the other side. Keep massaging for up to a minute until it goes away. Again, on the top of the heel, right there. But you use your thumb. Okay, massage it until the pain goes away. Some head points that you could do, and I have to find out, it took me a long time to do cranial work, but what I found is that when you get on the right spots, the most common areas for restrictions are the back of the head right here, and then front to back. And you go on the protrusions. So if you look at a picture of a skull on Google, there's different parts that are protruding out. Remember that part right there? That the furthest bone. Some people have a big bone right here in the back, but right there. And then that's a very common area. And then the 2 right behind the ear that protrudes out right here. So what I do is I put my thumbs on both of those mastoid processes right here, and put my fingers on the protrusions in the back, and I just kind of massage it out, and I use my nails to kind of dig in there, and I kind of just massage it out with my nails. Okay, and where you feel the most relief, stick to those points, and don't overdo it, but just do it enough so that you get some relief from the headache. Those are common areas. Then you could, another couple areas that are common are right below that big protrusion called the external occipital protuberance. Below that, you go about an inch down into the side, and you'll feel another couple of bumps. That's where your muscles attach to the skull, and that can cause headaches too. And if you press right in there, I could feel it radiate up this way. So you know that those are good spots when they radiate like that. So I dig my nails right into the back right there, right where the bumps come out. Okay, and I dig there. And the last couple of points is right here on the frontal part, the part that protrudes on the side of the head right here. Find it and dig in with your nails. Okay, and then I go like this, put it right in the front to wherever it's protruding out, and I kind of massage with my nails right into the forehead area and on the sides of the temple. Okay, so that's another part. And the last thing, after you do those things, I just go front to back on the frontal bone right here with the heel on the front, and also on that external occipital protuberance. And I just massage, and also my fingers are on the top apex, right in the back of the apex of the crown of the head. And so, and I just massage it, use my nails and go in there and just massage. And it's usually pretty sensitive for someone that has a headache. So those are the main points that I do. You know, you have to experiment and see what works. And sometimes if the pain is one-sided, you have to focus on that one side. And if it's central headache, then it's usually on both sides, front to back. And do it in that sequence to help with the headache. You know, start with the fingers, go to the head, and then use the Epsom salt and drink your water, and as well as the regular sea salt that we have here for just general weight loss. So let me know how your body responds if you are a patient, and if you have any comments to this video, I would love to hear your feedback. So I will see you in the next video.